Hi, everyone. Thanks so much for joining today's webinar. The topic today we'll be going over is Boeing open enrollment period, which is kicking off now for 2024. And there's few things that are more confusing than open enrollment, right? It's always, one of those pain points to go through. So we're going to do our best to get under the hood, break it down as simply as possible. So you could come out of this webinar knowing what you need to know and not being scared of taking on open enrollment. All right, so I'm going to share my screen and we'll jump right into the presentation here. So for today's agenda, we're going to break it down with a few different topics. We'll kick it off with an overall open enrollment overview from a 30,000-foot view. We'll then dive into the different plan options and the nitty-gritty of each to be considering. And we'll go over that question that always comes up. What is the HSA health savings account versus FSA flexible spending account? And how do we navigate it? I do want to make a note that these plan options are the same across all Boeing employees for full-time. However, the premiums, deductibles, out-of-pockets, a lot of the figures are different based on whether if you're union or non-union. And so the numbers that we're going to be focusing on are for SPEEA. However, the overall coverage that we do will apply across Boeing employees. Just keep in mind as we're going over premium amounts and things of that nature, those are SPEEA specific. And then we do have a slide that breaks out the difference for SPEEA versus non-union. And before we jump in, just a couple things about us. As many of you know, at Stabler Wealth Management, we specialize in working with Boeing employees and retirees. We have a team of CFPs, certified financial planners on the team. We are a fiduciary. And our real focus is personalized service to you that really helps drive better outcomes. And we are here to be by your side as you prepare for retirement, transition to retirement, and then take on retirement. And so I know retirement could be scary and uncomfortable, given, generally it's the first time you're going through that. That's always a hope. But again, we work on this every day and know the ins and outs of the Boeing plans. So please contact us and leverage our team. You can see the link to the website here, www.planyourboeingretirement.com. We'll take you right to the Boeing page. So check it out. Feel free to contact us. We're more than happy to help out in any way that we can. And one more before we jump into open enrollment, I did want to provide an update on the long-term care tax, which has been a real focus as of late, of course. And so that long-term care tax did go into effect back in July. That is a Washington state tax, and it's starting out at 0.58% of your W-2 wages. For anyone that picked up long-term care insurance during the exemption period a couple of years ago, you would have received an exemption letter that hopefully you gave to Boeing, so you were able to opt out and not pay the tax. And so if you haven't given that to Boeing, make sure to do so, because that tax can really add up. And on top of that, there is a bit of an expectation that tax rate will go up over time. If you did not get the long-term care policy and the exemption letter and decided not to opt out, you will pay the tax. You will receive a $36,500 lifetime long-term care benefit from the state, inflation adjusted. There's some qualifications in terms of how long you have to pay in to receive that. But as anyone knows that has, family members that have dealt with long-term care needs or different circumstance, that's not going to go that far, right? And so the one reason I really wanted to bring this up is that the state of Washington came out and said, hey, once you're opted out, and you do not need to keep your long-term care policy. And so for anyone that picked up a long-term care insurance beater to get out of a tax, Boeing had that trust mark offering, really encourage reviewing that, seeing if that still fits your needs. If it doesn't, if there's a different long-term care policy you should get instead, or if you plan to self-finance, because it's not cheap. And if it's inappropriate insurance for you and you're paying a sizable amount for it, that could add up over time. So it gets very confusing. This is another one. Yeah, please feel free to leverage our office and we could kind of go through the main questions to ask and the analysis with you. Okay, so rolling up the sleeves and getting into open enrollment. So first off, open enrollment is kicking off now, right? So started November 1st, goes through the 22nd. You all should have received packets in the mail. You could also go on the Boeing website, WorkLife, to fill out your enrollment, make any adjustments that you want to. So this is that few week period to do that. This is the only time to make healthcare adjustments throughout the year. Of course, you could always make a change next year, but you're kind of locking in. So it's definitely worth really reviewing and doing your diligence to make sure you're in the right plan for you and your family. The changes that you put in go in effect January 1st. There is a short couple week window where you'll get a confirmation letter of what you signed up for. And if that's not what you want, you have a short window to change or get that fixed per se. But more or less, yeah, once you hit submit, you're kind of submitting for the next year. And also there's that pesky health assessment, survey. You got to just do it. If you don't do it, it's $20 a month. They kind of penalty you on it. $40 for you and your spouse if your spouse is also on your Boeing plan. So knock out that assessment and avoid those little fees that add up. $20 to $40 a month doesn't sound like a ton, but that's $240 to $480 annually if you just never get around to it. So yeah, carve out some time on the weekend and knock that thing out. Okay, we're going to get into the real detail here. So there's several different health plan options that Boeing offers. We got Advantage Plus, Traditional, Select Network, and Kaiser. And then there's that Embrite kind of overlay that we'll go over there. The Advantage Plus is the most common one. About half of Boeing SPEEA employees are in it. And the way that it works is very low premium. And for some, it's a $0 premium. However, it's a higher deductible and a higher out-of-pocket cost. And so the deductibles did go up this year based on the IRS requirement for it to be a high deductible health plan. And so they went up $100 in individual, $200 for family. And so that takes it to $1,600 deductible for an individual and $3,200 for a family. And what that means is you're paying all those expenses until that deductible is met for health expenses that come up. And then once the deductible is met, you then switch over to a 10% co-insurance pay. So Boeing will pay 90% of the expense, you pay 10% until you reach your out-of-pocket max, and then Boeing covers the bill. We have a nice example in a few slides that goes over this. But the out-of-pocket max for the Advantage Plus is $3,200 for an individual, $6,400 for a family plan. This is the only Boeing plan that qualifies for the health savings account. It has to be a high deductible health plan. And therefore, all the other plans, if you do those, you can't contribute to your health savings account, nor will Boeing put money in. And Boeing does a pretty nice contribution. If you're in the Advantage Plus plan, January of every year, Boeing will make their contribution to your health savings account. $800 Boeing puts in for an individual, $1,600 for a family. And as of January, that's yours, right? Even if you left Boeing, a couple months into the year. And so they kind of pay that up front. And so that's a nice little boost, which is another benefit when you account for the lower premiums, but also what Boeing puts into the health savings account. The plan has the exact same network as a traditional plan, which is the next most common one across SPEEA. And they're very similar, the two, once your deductible is met. The difference is for families, all covered members share a single deductible and out of pocket. So what that means is if your spouse, you got 3 or 4 kids, as you each have medical expenses, you kind of add everything up and that contributes to hitting the family $1,600 deductible, for example. So each member doesn't have to hit $1,600 for the deductible to be met. You tally everything up. The traditional has a higher deductible, which we'll get into on the next slide, or excuse me, a lower deductible. However, it's per a person. It's not combined. And then also the subscription drugs are also subject to the deductible for Advantage Plus. Yep. The traditional medical plan, the second most popular, so about 40% of SPEEA is on this one. Lower deductible, $300 a year per person. And the out-of-pocket max is $2,000 per person, $4,500 for a family. And so, like the Advantage Plus, once your deductible's met, there's a 10% co-insurance. So you'll pay 10% of the medical expense after deductible. Boeing pays 90%. Once the out-of-pocket's met, which is lower, for this versus the Advantage, then Boeing covers the expenses. There's a separate out-of-pocket max for prescriptions. And really, when you compare the Advantage versus traditional, so again, 90% of SPEEA is in one of these two. The two considerations are, one, if you don't use your health insurance much generally, again, knock on wood, of course, right? You might want to do the Advantage Plus. The premiums are cheaper. You get the health savings account benefit, the HSA. Or if you got a big family, you got 10 kids, right? And you're saying, gosh, I don't want to hit a 300 deductible per person. We're going to hit that family one much quicker. That might be another case where it's not per person on the plan. It's all collectively to hit that family deductible. So that might be another case where the Advantage Plus comes up. It's a bit of a math problem, right? And so there's some risk return based on no matter which one that you choose. We are happy to run the math. I almost put on a slide on here comparing the math of a couple options, but it's so individual based on each family and person situation that, yeah, if you want to go over any of this or want us to kind of run the break even or, kind of at what point, which one makes sense for you and your family, yeah, let us know and we'd be happy to kind of help out with that. Okay, the other two plans, the Select Network plan and the Kaiser plan, these make up less than 10% of SPEEA, right, that are in these collectively. And they provide no out-of-network benefits. So the only non-network claims that are accepted are for emergency room visits. And the premiums are very, very high. And so between the premiums and the lack of non-network coverage, most employees do not select these plans. There is no deductible and no co-insurance, just a copay. And that's, when you have each visit, you pay a copay like $25 or something, for example. And so other than the premiums, it is inexpensive outside of that. But man, it takes a lot of $25 copays to hit, the really high, premiums that you pay, which I'll show you on the next page. So generally, this is not a good bang for your buck deal. And then, yeah, Kaiser's an HMO with a very limited network, right? That Kaiser network. Yeah, here's sort of a nice overview. So you could see a lot of Advantage Plus, a lot of traditional, less Select, and very little Kaiser. So this is a SPEEA population going back to 2022 in terms of how many people, what percent signed up for what plan. Yeah, kind of fascinating. You see a big change in 2018. Traditional used to be, nearly 85% of SPEEA. And then at that point, Boeing made a change where they basically ticked up the benefit of the Advantage Plus and incentivized it. And then you saw a massive shift from traditional to Advantage Plus, which before was very minimal. And, like I noted, since then, more in Advantage Plus, but traditional has a big following as well. Yep. And you can, another kind of observation is if you look at that Advantage chart on the far left, you could see that each year you're seeing a bit more signing up for Advantage. It's kind of ticking up as well. Okay. I mentioned enrollment's confusing. Here's a great example. So monthly premiums, again, this is for SPEEA. In 2023, so basically this year, right, that you've been living, this was the introduction to the tiered system. And basically what happens is your base salary from the prior July drives the premiums that you pay for the next year. And so they have these pay bands now. It used to be, everyone would pay the same amount, no matter if you made 100,000 or 200,000. Now, based on your pay band, you pay more or less. Get this question all the time. The pay percentage is not the percent of your salary that you have to put towards health insurance. It's a percent of the plan that you're on the hook for, that you're paying for on the premiums. The rest would be Boeing. And and again, like I noted, the cost was the same regardless before this. And so Advantage used to just be 0%, no premiums for everybody, no matter what your pay band was. Traditional 5% flat, and then other 12%. So you could see if you're in pay band 2 or 3, so pay band 2 is $100,000 to $200,000 of annual base salary. Pay band 3 is $200,000 or more for SPEEA. Someone in pay band 1 is paying 0% for Advantage Plus. If you're in pay band 3, you're paying 9%, right? So that's an extra 9%, per year, and that's of a plan cost. And so it did get quite a bit more expensive. It's still very reasonable compared to what many other companies' health plans cost, but it did get a bit more expensive, starting in 2023. All right, this chart's got a lot going on it, so I'm just going to highlight a couple things. So this shows the premiums, out-of-pockets, co-insurance, co-pays for each different grouping, and I'd be happy to send this to anyone that would find this helpful. And so you could see Advantage Plus, key takeaway, lowest premium. If you're at the $0 or first pay band, $0 premium. Traditional, higher premium, but it's a lower deductible and low out of pocket, though the family does not share the deductible like the Advantage plan. The Select plan, most expensive premium, you could see, for example, in the highest pay band for an individual, it's $135 a month, right? So that could be very steep, compared to the other options. In high out of pocket, but no deductible, no co-insurance. And so, like I noted, it'd be a lot of $25 doctor visits to get to your out-of-pocket max on that one. Okay, for probably quite a few of the folks joining this webinar, and yeah, don't be ashamed, if that's you, a lot of this is just like, what's going on, right? How does this co-insurance work versus copay versus this versus that? And so sometimes it's helpful to just see an example, like dollars and cents. What happens if I have a big medical expense? And so in this sample, you get a $25,000 medical expense, right? You're bust up your knee or something, and you have a big surgery procedure, and you got to go through a big expense. Okay, $25,000 expense, that's line 1. There's always a negotiated discount, right? That, these insurance companies and providers have with, the different healthcare providers. And so in this case, let's just say the negotiated discount was $10,000. Again, you don't see this so much. The allowed amount that can be charged would be $15,000, right? And so that's what your insurance plus you are on the hook for. This is a traditional plan for SPEEA. So the individual deductible is only $300, right? So you pay the $300 in line 4, and that leaves $14,700 that needs to be paid. As I noted before, there's that in-network co-insurance. So once the deductible's met, you still have skin in the game. You're paying 10% of the expense, and Boeing's paying 90% until you reach your out-of-pocket max. And so you could see in this instance that the in-network co-insurance of $1,470 means that Boeing Insurance is providing $13,230, and you are out of pocket $1,770 for this $25,000 expense. And so that's kind of an example of how the math works. And as noted on the prior slide, yeah, in network, that 1,770, the $2,000 out of pocket max is $2,000. So let's just say it was a $40,000 expense. You will never be subject to more than $2,000 out of pocket for in-network care like that, right? So that 1,770 will never be higher than 2,000 for your total out of pocket for the year, including other medical expenses you've already paid in. Okay. Okay, not confusing enough. We got one more option. This is the Embrite Preferred. This used to be the UW Preferred plan, and they did a rename of it, but essentially the same thing. This option is available for Advantage Plus, Traditional, and the Select Network plans. And basically, it's cheaper. You only, you save $30 a month reduction in healthcare premiums. Of course, you can't go lower than zero, right? So may not always make sense depending on your pay band that you're in. But the drawback is limited network. You have to move to UW Doctors Network. And so this is really tough option for those that are not in the Puget Sound area. Even in Everett, right, it may be very tough to find in-network options. So you really want to research the doctors and make sure that it's a fit for you before you sign up on this, to try to get the lower premium savings. If you do the Advantage Plus the Embrite overlay, Boeing does increase your health savings account contribution they put in. So rather than $800 an individual, they'll put in $1,280, right? So another $480, which could also be meaningful. And there's some other features as well. About 25% of the Advantage Plus folks are on this, and about 10% of those in Traditional have elected for this one. You got to be careful. We have an instance of someone we work with before. They had a big procedure schedule, and their doctor recommended someone with a specific hospital, right? And it wasn't UW. And it was a complicated procedure, and so they needed to have the right person do it. And as a result, they ended up delaying this procedure several months until the new open enrollment period. Since it wasn't in network under the Embrite, which they were signed up for, the specialist doctor that they were scheduled to see. And that could be scary and uncomfortable, right? So again, whenever you're dealing with health insurance, first and foremost, you need the right plan, you need the right network. It has to fit you and your family's goals. From there, you want to optimize for lower premiums and expenses and more health savings account. But again, your health is so important. You got to be really careful when selecting this one so you don't get pigeonholed into something that doesn't fit your needs. But again, there's some instances if you're already using UW Doctors and the hospital's right down the street from you and everything lines up, then great. That could be a good fit, and it is a good chunk of savings. I wanted to have one slide in here about how all this works when you're retired. And so Boeing, if you qualify for early retirement medical, that's a big deal. And kind of generally that means, at the time of retirement, you were last hired before 2007, essentially. And, so what this does is, commonly 55 is a bit of a magic number for retirement at Boeing. Of course, many people work beyond that, but it's really hard to retire before 55. But someone, may retire at 55, 56, 57. That could be like 8 to 10 years before you're on Medicare. And if you didn't have a Boeing early retirement medical, you'd be on your own for health insurance, which can be very pricey. You may have a younger spouse too, right? That could be even longer until Medicare age. And so this is a great asset if you qualify in terms of giving you much more flexibility in retirement. Crunching the numbers, that early retirement medical plan to get to Medicare age 65 for many, it could be worth like $300,000. And so this is a really important feature. And so basically, yeah, if you qualify and you have the service time and, we're last hired date and everything, once you're 65, you would go on a Medicare, but between retirement and then you would stay on Boeing health insurance plan. They made a small increase to the premiums in 2023, still a really good deal, right? So nothing to lose sleep over. And this is an important one as you're approaching retirement. Make sure to confirm with HR and just dot your I's, cross your T's. Make sure if you think you're set up on it, confirm that you are, because this is a really big needle mover in terms of retirement flexibility. And so a big deal to really understand. One note, I know I've mentioned this before. If you turn 65 before your spouse and go on Medicare, you need to be on some form of Boeing retirement for your spouse to continue to be on it as well. So if you're 65 and your spouse is 62, you likely will want to choose a Boeing supplemental Medicare plan. So your wife can continue to be on the Boeing early retirement. Again, some people like the Boeing supplemental. It's kind of a Cadillac prescription plan, but it's not cheap. But again, there's a lot of nuances about, retirement insurance that are really critical. I do understand that retiree medical is something that Boeing can technically take away. There'd be a big outcry. There's a lot of dependency on it, right, for retirees. But some things are locked in under contract, others aren't. And so I understand, while likely something that will be there, there's always kind of a remote possibility that it may not be. So it's good to have a little bit of a parachute plan, right, just in case that got yanked away, which I don't expect, by the way. Okay, yeah, so to kind of sum it up, here's a chart of the monthly premiums with the different types of plans. Something I really wanted to note here is that if you're in pay band 1 and you're on the Advantage plan, your premiums are $0 a month, right? It doesn't cost you anything. It's really better than that because with the Advantage Plus plan, Boeing's putting in $800 per an individual, $1,600 for a family. And so $800 a year, that comes out to $67 a month. And so you're kind of getting paid premiums, right, in that instance, where pay band 1 Advantage Plus is $0 premium. And then you also get the health savings account contribution as well. And the offsetting is a higher deductible, higher out-of-pocket, of course. And reminders for SPEEA, pay band 1 is $0 to $100,000 of base salary. Pay band 2 is $100,000 to $200,000. Pay band 3 is over $200,000. And it looks at your prior July pay to determine that for the next benefit year. Quickly on dental plans. For SPEEA, there's 3 dental options through the dental or Delta Dental of Washington. These are not free for union employees, so that just applies for the SPEEA. The DDWA preferred is like basically what everyone does, in most instances. There could be some one-off instances where you don't, but essentially it's recommended for most SPEEA. For the highest benefit, use an in-network provider. 98% or so of dentists are in network, so it shouldn't be an issue, but confirm with your dentist. And there's also nationwide and network coverage. So this tends to be a pretty sweet deal. The scheduled option 2, is pretty old school. Supposedly they haven't changed the reimbursable fee schedule for 20 years. And inflation's gone up a lot over the last 20 years, right? Especially the last couple. And so it's kind of become obsolete. So this DDWA preferred is really kind of a go-to. They do have prepaid dental plans. The way it works is you basically pay monthly. The dentist gets a monthly payment, whether they see you or not. So it's kind of paid up front. And so the incentives don't really align, right? And so, yeah, notes for SPEEA. This one, I guess, gets more complaints than the other 2 combined. So generally, the preferred option is the way to go. I've noted a few times throughout the presentation that these are SPEEA figures in terms of premiums and out-of-pocket and everything. And it's true. The SPEEA versus non-union, SPEEA medical plans cost significantly less than they do for non-union workers. lower deductibles, lower out-of-pockets, and lower copays. Also, the SPEEA pay tiers are $100,000 bands for where your premiums go up. For non-union, it's $75,000 plans. And so what that means is if you make a base salary of $155,000, that's pay band 2 for SPEEA, but pay band 3 for non-union, which will drive even higher premium charges. And then non-union also has to pay their dental. When you sum it all up, rumor has it that the total cost comes out to about $6,000 a year for a family that's in pay band 3 traditional, more for non-union versus SPEEA. So pretty significant. And then here's a chart that shows the various pay bands in the plan types. So you could see that top half's for non-union, so the $75,000 pay bands. That second box should say 75,000 to 150, by the way, the green box. And then the bottom half is for SPEEA, so $100,000 bands. And you could also see that the percentages are a bit higher, and in some cases, such as for traditional, substantially higher, for non-union versus SPEEA. Not much you can do with it, but again, I guess that's a benefit for SPEEA. Okay, get a ton of questions on health savings accounts. To sum it up, they're really cool. And so basically it's a triple tax advantage. So money that you put in a health savings account reduces your taxable income. You don't pay tax on those wages. So boom, that's benefit one. Second, all the growth in the health savings account. So you should invest these like an investment account in most cases. All the growth is tax deferred. So you're not paying capital gains and dividends and things like that. So that's kind of benefit two. And then the third benefit, as long as it's used for some qualified form of medical, which is pretty broad, when the money comes out, you don't pay tax on it either. That's kind of like the way a Roth works, right? When the money comes out, it's tax-free. And so this is the most powerful, retirement tool there is, match aside. For 2024, so for next year, if you're over 50, you could put some extra in. But a family that's on the Advantage Plus plan can contribute a total of $9,300 into this preferred health savings account, which includes what Boeing puts in. And so this limit went up $300 a person, $550 a family from the prior year. And like I noted before, so for Advantage Plus, Boeing contributes $800 an individual, $1,600 for a family. And so, what that means is the total 9,300 that can go in, that's reduced by, Boeing's share, right? As well. So I believe that's 7,700 that you can put in plus the 1,600 from Boeing. I want to check my math. These are portable if you change employers. They're always vested. They're yours, right? It's different than a flexible spending account. But there are some eligibility restrictions. Like noted before, you have to be on an Advantage Plus plan to do these, which is Boeing's only high deductible health plan. If you're double covered, so on your spouse's insurance as well, and your spouse is not in a high deductible health plan, you can't do it. You don't qualify. And also a spouse's flexible spending account can disqualify you as well if it's not the right type. And then if you're enrolled in Medicare or TRICARE, you don't qualify to contribute. You could still use it though, what you've amassed and built up. Yep, and kind of one other note, so that $9,300 for a family is total for you and your spouse, right? So you can't put in $9,300 and your spouse can as well. So that's kind of total across the board, all the health savings account contributions. Using the health savings account for medical expenses, you can use it to pay claims, especially because the Advantage Plus has a higher deductible, or you could invest it and let it grow, which tends to make it the most powerful. When you let it grow, you will use it at some point. You could use it for Medicare premiums down the road. Anything eligible under the Boeing insurance plans, any eligible expenses are eligible to use a health savings account for as well. And then there's additional uses like LASIK or reading glasses or braces or dentures. And so health expenses are going up right over time. That's kind of a known thing. along with taxes. So you will have a chance to use it. So if you're 50 or 55, for example, you might want to use it, or you might consider filling that thing up every year, letting it grow tax-free, and then using it, in 10 years or so, once it's grown mightily, with no taxes. So again, happy to chat on that one as well. Okay, flexible spending account, FSA, to sum it up, HSA is better in most cases, a health savings account. The goal of this is, again, to save on taxes. What you put in there, you're not being taxed on as wages, but it has to be used for medical expenses. 2023, you can put about $3,000 into this each year. And of that, it's use it or lose it, basically. So 550 of the balance can roll one time to the next year. But beyond that, if you don't use it, it goes away. And you can only roll a given amount once. You can't take that 550 and roll it and then roll it and roll it the same amount. So you really want to plan to use it. So make sure you really budget what your medical expenses are if you're going to use one of these. If you're going to be Advantage Plus, generally do the health savings account first. This would be next if you really wanted to. You can have this in addition to a health savings account. Once you're maxing out your health savings account, for example, you could contribute here, but it has to be a limited purpose FSA. And basically, the only difference there is that you could use it after you satisfy your deductible for all the same usage, but you can't use your FSA before you satisfy your deductible if you are doing the health savings account as well. If you're not in an Advantage Plus plan, this could be an okay option, right? Again, you want to make sure you're budgeting out your expenses and using it. But since you're not eligible for the health savings account, it could make sense, right? Something to consider. Supplemental savings plan. This is a fancy way for what's called a deferred compensation plan, where basically you could put even more money on top of maxing out your 401k into the SSP. And what you put in there is tax deferred. So it reduces your taxes when you fund it. And then when the money comes out down the road, you pay tax on it at that time. My general sense is that you lose a lot of flexibility for doing this. Both it locks in your 401k elections for the benefit year. And then also it's a little bit of a forced schedule in terms of how it pays out in retirement. You could have so much room with your 401k at Boeing, between the traditional contributions or Roth. If you're over 55, you can do 30,000 a year. Plus on top of that, or excuse me, over 50, plus on top of that, you can do the mega back to Roth, the actual additional after-tax money, which is close to another 30,000 or so you could put in. I think there's plenty of opportunity in a tax advantage way to not use the SSP. So that's kind of my view. But if you're a total super saver and saving 100,000 a year or some, incredible number, right? We could talk about whether it makes sense. But in most cases, I think there's better routes to go that give you more flexibility. Okay, I know we blitzed through a lot of ground. I hope that helped quite a bit in terms of uncovering and understanding what we just went through. In general, we're always here to meet with you and review your options. As a benefit for joining, we are offering a 1-hour complimentary financial checkup, and we could review open enrollment, we could review pension lump sum options, we could talk investments, you name it. It's really your time. And so, yeah, we've had great success and great conversations doing this. So take us up on it. Again, we do a ton of these. And so we really recommend it. It doesn't cost anything. And that hour is for you, however you want to spend that time. The best way to sign up for that complimentary 1-hour review is go to our website, www.planyourboeingretirement.com. It takes you to our Boeing page. Hit that big yellow button in the top right, Let's Talk. And that will take you to a page where you could either book a meeting online or send us a note that you want to meet, and we'll follow up with you. But yeah, really encourage it. This stuff's important and confusing. And again, we're here as a resource for you, so you don't have to recreate the wheel yourself. And beyond that, we're going to be holding more of these seminars and webinars to cover additional topics. This open enrollment one was from feedback, right? This is the first time that we've done this. So if you have any other topics you'd love for us to cover, shoot us a note and let us know. And please extend these invitations to your colleagues, right? These are for all Boeing employees. And so, yeah, we'd love to hear from others that you care about and help share information with them too. Yeah, reach us out on our website if you have any questions. Again, really appreciate your time joining this webinar today, and hope to hear back from many of you. So thanks again and take care.